The Women's Leadership Center, through its Zambezi for Women's Rights program, held an engagement where trainers met with stakeholders from different ministries to bring forth issues that women in rural areas are faced with regarding service delivery.
We hope to equip and empower them with information, because a lot of the problems arise from that. Not only do our women and children especially not aware of their rights, but should, even if they are aware, should their rights be violated, they don't know where to go. Who do they report to? So that's number one. The stakeholders are who they report to. These are the people in the offices, the powers that be. These are the people who are entrusted with implementing these laws that should be implemented. So we hope to have them hear from the women and then take back to whoever they report to, or if they are the people on the ground, then listen to these women's views and tell us what they can do about it or what they're already doing about it if they are already working on the issues.
The participants maintained that until equality in social status is addressed and practiced, most women in predominantly lower societal standing will continue to be discriminated against. These, they said, include treatment of patients at health facilities, difficulties in registering births of their children, discrimination against women when they report abuse to police officers who allegedly send them back and be told to fix their marital issues at home.
The Ministry of Gender. When these women go to your offices to explain that the men in the households are misusing the grounds meant for children and ask you to make changes to the arrangements made, you speak to them in a very harsh manner. You speak very harshly without receiving them well to explain that what needs to be done or tell them what the procedures to follow. Rather than that, you yell at them to go back and sort it out with the same violent man who is likely to hit them. Especially in Ward 2. To the nurses in Ward 2. If a woman is in need of birthing assistance, the nurses do not pay attention, even after she explains to them what she is feeling or going through. What they will do is shout and speak harshly towards her if she looks poor.
The group also said the rising number of GBV cases in the region is worrisome and asked for educational sessions on protection orders, particularly in rural areas. Muya hopes that issues discussed at the meeting will be addressed further by the line directorates to bridge the gap on access to women's rights information and where to seek assistance if need be.